The pharmaceutical cold chain networks across Central Europe operated within their normal temperature parameters. On November 19, 2024, logistics coordinators monitored refrigeration systems transporting temperature-sensitive medications with the precision that keeps vaccines, insulin, and biologics viable during distribution. Storage facilities from Vienna to Prague maintain temperatures between 2 and 8 degrees Celsius. Refrigerated transport trucks logged their cargo temperatures every 60 seconds. Automated monitoring systems tracked thousands of shipments simultaneously. Nothing indicated that embedded control systems were being systematically compromised. The first indication appeared as a sensor calibration issue that seemed routine enough to defer. At Aero 347 UTC, a distribution center in Bratislava logged a brief temperature fluctuation in cold storage unit 7. The refrigeration system reported 8.4 degrees Celsius for approximately 90 seconds before returning to the target range of 5 degrees. The deviation remained within acceptable variance. Pharmaceutical cold chain protocols allowed brief excursions up to 10 degrees without requiring product disposal. The facility manager who reviewed the automated alert marked it as a potential sensor drift issue and scheduled recalibration for the next maintenance cycle. The temperature stabilized. The incident closed without investigation, but the pattern was spreading. Over the next 19 hours, similar temperature anomalies appeared across cold chain facilities in 7 countries. Storage units in Budapest reported brief warmings. Distribution centers in Warsaw logged sensor inconsistencies. Pharmaceutical warehouses in Munich experienced unexplained temperature excursions lasting between 2 and 7 minutes. Each event remained below the threshold that would trigger product quarantine or emergency response. The incidents appeared random. Different facilities, different times, different refrigeration systems from different manufacturers. No single monitoring authority could see the pattern because cold chain logistics operated through fragmented commercial networks with separate tracking systems. At 23:15 UTC, the pattern became impossible to ignore. 43 refrigeration units across Central Europe simultaneously reported temperature increases exceeding protocol thresholds. The warming events appeared in coordinated geographic clusters, starting from eastern facilities and propagating westward across the distribution network in less than 11 minutes. Cold chain operators initiated emergency protocols. The actual medications remained viable. Most temperature-sensitive pharmaceuticals could tolerate brief warmings without immediate degradation. But the coordinated nature of the failures indicated something beyond equipment malfunction or power disruption. The European Medicines Agency activated its Supply Chain Crisis Coordination Center. What looked like scattered equipment failures was revealing itself as systematic manipulation. The industrial control systems that regulated refrigeration weren't experiencing random malfunctions. They were being deliberately targeted. Every pharmaceutical cold chain depends on networked sensors and automated controls to maintain precise temperature ranges. When storage temperatures drift outside those ranges, protocols require quarantining affected products, conducting stability testing, and potentially destroying inventory worth millions of euros. Even brief disruptions can create supply chain chaos that takes weeks to resolve. Technical teams began reconstructing the attack timeline. The temperature manipulation had been active for at least 21 hours before the simultaneous warming event made the pattern visible. During that period, control systems had been experiencing intermittent interference that appeared consistent with normal operational variations. The attackers had been testing response thresholds, introducing small temperature changes to map how monitoring systems reacted and what deviation levels triggered human intervention. Analysis teams identified the vulnerability architecture within 6 hours of full alert status. The attack didn't target refrigeration hardware directly. It exploited the networked control systems that manage temperature regulation. Many cold chain facilities used internet-connected monitoring platforms that allowed remote oversight of multiple locations from centralized operations centers. These platforms improved efficiency but created network pathways that sophisticated attackers could exploit to access industrial control systems. The technical analysis revealed alarming sophistication. Rather than simply disabling refrigeration systems, the attack introduced graduated temperature increases designed to maximize damage while evading immediate detection. The warmings progressed slowly enough that automated alerts interpreted them as equipment degradation rather than deliberate sabotage. The geographic coordination suggested the attackers had mapped the entire pharmaceutical distribution network across Central Europe and timed their operation to impact maximum inventory during peak distribution cycles. If the operation had continued undetected for another 14 hours, it would have intersected with morning distribution operations, when refrigerated warehouses shipped their largest volumes to hospitals, pharmacies, and clinics. The temperature protocols would have required quarantining affected inventory. Medications with any documented temperature excursion outside specified ranges must undergo stability testing before distribution. The testing process typically required 48 to 72 hours, creating immediate shortages of critical medications while supply chains scrambled to source replacement inventory. The cascade modeling revealed the scale of what had been narrowly avoided. The affected facilities stored medications serving 67 million people across 8 countries. The inventory included 8.3 million doses of insulin for diabetic patients, 12.6 million vaccine doses for routine immunizations, 4.7 million units of blood clotting factors for hemophilia treatment, and extensive stocks of cancer biologics, antibiotics requiring refrigeration, and emergency medications. A quarantine event affecting even 30% of this inventory would have created immediate shortages of life-critical medications across Central Europe. The consequences extended beyond medication availability. Diabetic patients require continuous insulin access. Interruptions of more than 24 hours create medical emergencies. Hemophilia patients need immediate access to clotting factors when bleeding episodes occur. Cancer patients on biologics follow precise treatment schedules that cannot be safely interrupted. The modeling indicated that a sustained shortage affecting these medication categories would have forced 340,000 patients to seek emergency medical care within the first 48 hours, overwhelming hospital capacity across the region. Pediatric vaccine programs represented another critical vulnerability. The affected inventory included routine childhood immunizations scheduled across hundreds of clinics. A quarantine event would have forced cancellation of approximately 180,000 vaccination appointments, while replacement doses were secured and redistributed. The resulting gaps in immunization coverage would have created population-level susceptibility to preventable diseases. Exactly the scenario public health authorities had worked decades to eliminate through consistent vaccine availability. Hospital pharmacies would have faced impossible triage decisions. With limited stocks of critical medications and uncertain resupply timelines, pharmacy directors would have needed to prioritize which patients received available inventory. Cancer patients mid-treatment versus newly diagnosed cases. Hemophilia patients with active bleeding versus prophylactic treatment. Insulin-dependent diabetics based on severity of need. These decisions would have created ethical dilemmas that medical systems were poorly equipped to navigate. The National Security Agency had been tracking the control system intrusion since 11:30 UTC, nearly 12 hours before cold chain operators recognized the coordinated pattern. The initial detection came from network monitoring systems that identified unusual command sequences being transmitted to industrial control platforms used by pharmaceutical logistics companies. The commands matched signatures associated with previous attacks on industrial control systems but demonstrated enhanced sophistication in targeting and coordination. Within 7 hours, NSA analysts had mapped the attack infrastructure, identified the compromised control platforms, and begun coordinating with European partners on containment strategy. The challenge wasn't just stopping the temperature manipulation. It was doing so without creating additional disruptions to refrigeration systems managing billions of euros in temperature-sensitive inventory. Abruptly disconnecting compromised control systems could cause refrigeration units to fail entirely, creating exactly the medication losses the attack had been designed to cause. The countermeasure deployment began at 0240 UTC. Cybersecurity teams worked with control system manufacturers to push emergency firmware updates that isolated compromised components while maintaining refrigeration functionality. The updates implemented additional authentication layers that blocked the attacker's command sequences without disrupting legitimate temperature control operations. Simultaneously, cold chain operators activated backup monitoring systems and increased manual oversight of refrigeration performance. The system restoration required coordinated effort across multiple manufacturers and hundreds of facilities. Each refrigeration platform required verification that temperature control had returned to legitimate parameters and that no additional malicious code remained embedded in control systems. The process demanded careful validation. Rushing the restoration could miss persistent threats that would reactivate after defensive attention diminished. By 0820 UTC, pharmaceutical cold chains had returned to normal operations. Temperature monitoring showed stable conditions across the affected facilities. Medication inventory underwent precautionary integrity testing to verify that brief temperature excursions hadn't compromised product viability. Regulatory authorities issued guidance regarding enhanced monitoring procedures and accelerated security updates for networked cold chain systems. The immediate crisis had been contained, but the vulnerability remained. The investigation revealed additional troubling details. The attackers had maintained persistent access to cold chain control systems for at least 17 days before initiating the temperature manipulation. This reconnaissance period allowed them to map facility layouts, understand operational patterns, and identify optimal targeting strategies. The access credentials had been obtained through sophisticated phishing operations that targeted logistics coordinators and facility managers, individuals whose legitimate access privileges provided pathways into control systems. The attack timing showed strategic calculation. November represented peak distribution season for flu vaccines and seasonal medication stockpiling before winter demand increases. The affected facilities were operating at approximately 85% of storage capacity, meaning any significant quarantine event would have created immediate shortages without available backup inventory. The 14-hour window before morning distribution operations represented the time frame the attackers needed to maximize disruption while avoiding early detection. The geographic targeting demonstrated knowledge of pharmaceutical supply chain architecture. The affected facilities included primary distribution hubs that supplied secondary warehouses and direct-to-pharmacy shipments. Disrupting these hubs would have cascaded through entire regional networks, affecting not just the immediate facilities but downstream distribution channels serving thousands of healthcare providers. The operation also highlighted cascading vulnerabilities in healthcare infrastructure. Medication shortages don't just affect individual patients, they stress entire medical systems. Emergency departments experience surges from patients unable to access routine medications. Hospitals postpone elective procedures requiring specific drugs. Pharmacies implement rationing protocols that create access barriers for vulnerable populations. The compounding effect of these disruptions extends recovery timelines from days to weeks. European pharmaceutical authorities and the NSA conducted extensive analysis of the attack methodology and infrastructure. The technical fingerprints showed innovations beyond previous industrial control system attacks, specifically the graduated temperature manipulation designed to evade detection thresholds and the sophisticated coordination across geographically distributed facilities. This suggested either capability advancement by known threat actors or new operators with specialized expertise in pharmaceutical logistics vulnerabilities. The incident triggered comprehensive reviews of cold chain security across the healthcare sector. Pharmaceutical companies accelerated deployment of isolated control systems with enhanced authentication requirements. Distribution facilities implemented additional physical security measures for network infrastructure. Regulatory authorities updated their guidelines to require regular security assessments of networked cold chain platforms. But the fundamental vulnerability persisted. Pharmaceutical logistics increasingly relied on networked automation to manage complex distribution operations. The efficiency gains from centralized monitoring and control created network pathways that sophisticated attackers could exploit. The same connectivity that enabled real-time temperature tracking across thousands of shipments simultaneously also provided access routes for malicious actors with sufficient technical capability and operational patience. The behavioral analysis revealed concerning patterns. The 17-day reconnaissance period demonstrated operational discipline that exceeded typical cybercriminal timelines. Most attacks on commercial networks sought immediate financial gain through ransomware or data theft. This operation showed different characteristics: prolonged observation, careful calibration of attack parameters, and targeting that would maximize public health impact rather than direct financial return. Geopolitical analysts noted the potential strategic motivations. Pharmaceutical supply chains represented critical infrastructure with vulnerabilities that conventional military operations couldn't easily exploit. A successful attack creating widespread medication shortages would undermine public confidence in healthcare systems and create political pressure during a period of existing strain on medical resources. The timing coincided with ongoing diplomatic tensions regarding pharmaceutical pricing and export controls. Public health authorities conducted modeling to assess resilience against future cold chain attacks. The simulations tested scenarios where temperature manipulation affected larger percentages of inventory, targeted different medication categories, or coordinated with other supply chain disruptions. The results showed that existing response protocols assumed localized failures, not coordinated attacks across regional distribution networks. The recovery mechanisms that worked for isolated equipment failures would be overwhelmed by simultaneous disruptions affecting multiple critical facilities. Emergency stockpile programs received renewed attention. Many countries maintained strategic reserves of critical medications for pandemic response or mass casualty events. The cold chain attack demonstrated that these stockpiles could provide buffer capacity during supply disruptions. But accessing and distributing reserve inventory required coordination mechanisms that had never been tested under crisis conditions. The program reviews identified gaps in rapid mobilization protocols and unclear authority structures for activating reserves. The insurance and pharmaceutical industries began reassessing risk models for cyber attacks on cold chain infrastructure. Previous models had treated temperature control failures as operational risks related to equipment reliability or power outages. The demonstrated capability to systematically manipulate refrigeration systems across multiple facilities required new risk categories and coverage structures. Several insurers announced they would require enhanced cybersecurity measures for facilities storing high-value pharmaceutical inventory. Healthcare providers updated their shortage management protocols based on the incident lessons. Hospitals reviewed their ability to substitute alternative medications when primary drugs became unavailable. Pharmacy systems implemented enhanced tracking to identify patients most vulnerable to specific shortages. Emergency departments prepared for potential surges related to medication access disruptions. The planning exercises revealed fragilities in existing protocols and coordination gaps between healthcare providers and pharmaceutical distributors. The technical community developed improved detection mechanisms for industrial control system attacks. The temperature manipulation had evaded standard monitoring because it mimicked equipment degradation patterns. The new detection approaches used machine learning to identify coordination patterns across multiple facilities. Recognizing that simultaneous anomalies at geographically distributed locations indicated deliberate attack rather than coincidental failures. Implementation of these systems required months of calibration to avoid false alerts while maintaining sensitivity to genuine threats. The pharmaceutical industry conducted supply chain resilience assessments based on the incident parameters. The analysis revealed concentration risks in cold chain infrastructure. A relatively small number of distribution hubs handled disproportionate volumes of temperature-sensitive medications. Disrupting these critical nodes would create cascading shortages across wide geographic areas. Patient advocacy groups demanded transparency about medication vulnerability to cyber attacks. Diabetic patients needed assurance that insulin supplies wouldn't disappear without warning. Hemophilia organizations required understanding of backup protocols for clotting factor access. The pharmaceutical companies and healthcare authorities struggled to balance honest communication about vulnerabilities with avoiding unnecessary panic. International health organizations reviewed global medication distribution networks for similar vulnerabilities. The cold chain attack in Central Europe demonstrated a threat model applicable to pharmaceutical logistics worldwide. Developing regions with less sophisticated monitoring infrastructure could be even more vulnerable to temperature manipulation attacks. The economic impact analysis revealed financial vulnerabilities beyond immediate medication losses. The potential losses from a successful cold chain attack, destroyed inventory, emergency resupply costs, liability claims from treatment interruptions could reach billions of euros for major pharmaceutical distributors. The technical investigations uncovered additional attack infrastructure that hadn't been activated during the operation. The intrusion into cold chain control systems had included deployment of secondary malware designed to corrupt backup systems and monitoring databases. The discovery suggested the attackers had planned for extended operations and potential defensive responses. Forensic analysis revealed the attack had exploited vulnerabilities in legacy industrial systems that pharmaceutical companies had delayed upgrading due to cost and operational complexity. Many cold chain facilities operated refrigeration controls installed a decade or more earlier, running software that no longer received security updates. Supply chain security specialists noted parallels between the cold chain attack and previous operations targeting other critical logistics networks. The methodologies showed consistent patterns: prolonged reconnaissance, exploitation of networked control systems, graduated degradation designed to evade detection, and targeting of critical nodes that would maximize cascade effects. The systems remained stable. Refrigeration units maintained their precise temperature ranges. Medications preserved their therapeutic viability during storage and transport. The 67 million people served by Central European pharmaceutical supply chains accessed their prescriptions without awareness of the control system vulnerabilities that could have disrupted their treatment. Everything worked normally, until the moment it wouldn't.